This article investigates the risk factors associated with complications from peripheral intravenous catheters, or PIVCs, in dogs hospitalized in critical care units. PIVCs are commonly used in both human and veterinary medicine to administer fluids and medications intravenously. While they are essential for treatment, complications can arise. This prospective observational clinical trial was conducted at Colorado State University Veterinary Teaching Hospital from October 2022 to March 2023. The study included 107 dogs that were hospitalized in the critical care unit for at least 24 hours. The researchers developed a standardized protocol for PIVC placement and monitoring. The protocol included steps such as wearing gloves, clipping the hair around the insertion site, aseptically preparing the skin, securing the catheter with tape and a transparent dressing, and covering it with cast padding and a self-adherent bandage. Trained personnel, including veterinarians, technicians, and students under direct supervision, placed all PIVCs. Data collection involved 4 self-designed forms that gathered information on patient and PIVC-related data, PIVC monitoring data, PIVC removal data, and PIVC complication data. Patient-related data included signalment, reason for hospitalization, emergency placement, personnel classification, acute patient physiologic and laboratory evaluation, APPLE scores, mobility status, recent PIVC placement, and number of PIVCs placed at admission. PIVC-related data included gauge, insertion site, administration of irritant and anticoagulant medications, PIVC dwell time, and whether the PIVC was placed in an emergent setting. The researchers monitored the PIVCs twice daily, assessing catheter wrap integrity, limb swelling, and signs of inflammation or bleeding at the insertion site. They used a previously published visual infusion phlebitis, VIP, scale to grade phlebitis, ranging from 0 to 5. Table 1 lists medications classified as irritant medications, including antibiotic medications, vesicant medications, hypertonic medications, and other medications. Table 2 outlines the visual infusion phlebitis scoring system, which assigns scores from 0 to 5 based on the presence of pain, redness, swelling, palpable venous cord, and fever. Table 3 presents patient and PIVC characteristics, including sex, recent PIVC placement, emergency placement, personnel classification, mobility status, insertion site, gauge, APPLEFULL scores, the number of catheters placed at admission, dwell time, irritant and anticoagulant medication administration, and PIVC complications. Table 4 displays continuous data, including age, weight, dwell time, length of hospitalization, APPLEFULL scores, and APPLEFAST scores. Table 5 shows the results of the univariable logistic regression model, including odds ratios, 95% confidence intervals, and p-values for variables like sex, recent PIVC placement, placement in an emergent setting, mobility status, insertion site, gauge, number of catheters placed at admission, dwell time, APPLEFULL scores, and anticoagulant medication administration. The primary endpoint of the study was PIVC complication, and the researchers followed the catheters until removal. The results of the study showed that the overall PIVC complication rate was 12.1%. The most common complications were phlebitis and extravasation, each occurring in 3.7% of the dogs. Univariable logistic regression analysis identified an APPLEFULL score greater than 35, and having 2 PIVCs placed at admission as risk factors for PIVC complications. A multivariable logistic regression analysis, performed on 76 PIVCs with complete APPLEFULL and APPLEFAST scores, revealed that increasing length of hospitalization, having 2 PIVCs placed at admission, and having an APPLEFULL score greater than 35 were associated with increased odds of PIVC complication. The study also found that body weight and dwell time were not associated with increased odds of PIVC complication. This finding challenges the routine practice of replacing PIVCs every 72 hours, suggesting that a clinically indicated approach may be more appropriate. The study had some limitations, including variability in individual technique for PIVC placement, lack of control for patient behavior and sedation use, potential for human error in documentation or classification of complications, and the single-center design, which may limit generalizability. The researchers concluded that increasing length of hospitalization, APPLEFULL scores greater than 35, and having 2 PIVCs placed at admission are risk factors for PIVC complications in dogs hospitalized in the critical care unit. These findings highlight the need for careful monitoring and management of PIVCs in these patients. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.